I'm Dr. C. Balakrishnan. I'm a consultant rheumatologist at the PD Hinduja National Hospital and Research Center in Mumbai. At the present moment, worldwide, there's been a good recognition for rheumatology, especially in the advanced countries like Europe and America. But unfortunately, rheumatology is still an up-and-coming branch as far as India is concerned, and it certainly, over a period of time, will have to deserve its place because the number of patients afflicted with this disease is quite a bit. I would say if you have to list rheumatology in the list of diseases that are prevalent in India, it would be probably in the first 15, probably down the list, down the order, and over a period of time it will ascend the order because the number of patients are quite large. The disease management is complex. One needs to make a proper diagnosis first. One needs to educate the patient because this disease, like diabetes and blood pressure, is a long-standing chronic disease. You will have to talk to them about how the pain is going to be managed immediately and how the disease is going to be managed with the drugs in the long term. The challenges at the moment are for the patients to come to a rheumatologist early on in the disease because time is of the essence as far as this disease is concerned. And if you catch these patients early and treat them well, then you could reduce or prevent most of the complications that these diseases can do. For example, if rheumatoid arthritis is treated early, then there is no deformity or damage that occurs, which often is irreversible. The second main challenge is probably to get well-trained rheumatologists to treat patients. Now, as far as training for rheumatology is concerned, even though it's much better than before, there are only about 9 or 10 centers which train medical students who have become a postgraduate and then come into a super specialty like rheumatology to get trained in the field of rheumatology. Only 10 for a large country like ours. One of the most important breakthroughs as far as management of these diseases are concerned are with agents called biological agents. When conventional, the often used drugs do not act or have failed, we do think in terms of these biological agents. And these are agents that are targeted, just like you have targeted chemotherapy for patients with malignancy. You have these targeted biological agents which act on a specific area of the immune system, trying to take care of that part of the immune system and not cause an immune suppression in the other areas. Therefore, the benefit is maximized and we try to reduce the side effects. Genomics is as important as it is in any other branch of medicine as it is in rheumatology. I think one of the main areas where genomics will be of great use will be to try and predict and prognosticate the disease progression in patients with arthritis. People with a particular gene in them will probably have a worse disease than somebody who doesn't have a gene in them. The second place where genes will be a major important part will be where which medication to give for which patient. Is still at the moment we are at the infancy of this. We are using the best possible medication first, but that might not be the best for a particular patient. So genomics, pharmacogenetics as I would say, will help these patients identify a drug which will be best suited for them. The USP of Hinduja Hospital has been to try and get these patients early to our clinic. Our clinic was established by Professor V.R. Joshi in 1988. And at the moment we are 3 of us and we see roughly about 1,200 patients of rheumatology every month. So as a center of excellence, we know that rheumatology is one of the main thrusts of this hospital, and many patients do come to us early on, and compared to what we used to see, say probably a decade ago, we see them much earlier. We are able to cater to their needs well, and we see a lot of change in the way these patients are being treated now and improving and going on ahead in their lives. I think if I look back 10 years ago, today I think patients with rheumatology are being treated much better than before, much earlier than before. We are preventing a lot of deformity and damage in many of the patients, especially in rheumatoid arthritis. And 10 years from now, we'll have better markers to predict, prognosticate, diagnose these conditions better. The radiology and radiological imaging would have advanced that much. We will be much better in the form of treating these patients, because we'll know more about these biologic agents, more about targeted therapies, how to combine target therapies, how to switch from one therapy to the other. I think with all this armamentarium in our hand, we'll be much better suited to treat these patients more effectively with less damage and disability. I think the government should probably look at two aspects of this important problem and important speciality. From the patient's viewpoint, many of these patients, especially with rheumatic diseases, have a lot of damage and disability. For some unknown reason, even now, the government is not giving these patients with rheumatic disability the same kind of importance as they would give for someone, for example, the one with an amputation or one with a malignant problem in the limb, etc. So I would probably think that these patients have the same amount of disability and pain, and they go through the same difficulties in day-to-day activities which the government can look at. As far as the second point which the government should really be looking at is at the training level, and I would urge the government to give more and more centers for training students in rheumatology after they have completed their post-graduation in internal medicine, so that we have more people, more trained rheumatologists to treat these patients effectively.